All right. Okay. Welcome, everyone. My name is Abby Strom, and I am the Child Care Initiatives Analyst with the Child Care Licensing Division here at DELC. And part of my job is to develop administrative rules and complete the engagement on those rules. I'm here today with several of my colleagues, and I'm going to have them just come off mute quickly and introduce themselves. Katrina.
Hello, everyone. I am Katrina Miller. I am the Infant and Early Childhood Mental Health Specialist with DELC.
Thank
Thanks for joining us
you.
today.
Thank you. Cynthia?
Welcome, everyone. My name is Cynthia Smith. I am a regional manager for CCLD in the Portland region.
Great. And Allison?
Hey everyone, I'm Allison Jalori. I'm the Child Care Labor Liaison here at DELC, and today I'm just note-taking. So
Yes.
nice to see you all. Thanks for being here.
It's a very important job to take all of our notes. All right, so as people are coming in, please feel free to put into the chat your name, the city you're joining us from, and then your connection to the work. This also helps us take attendance for who was present today during the meeting and for reimbursement purposes if you plan on getting reimbursed for your time here. And then just a final reminder that you do not need to be on camera, and any notes that are in the chat regarding the rules and feedback will be read aloud. All right. So for our agenda today, we will start with a brief overview as to what is a Rule Advisory Committee. And then we will also talk about the scope and the focus of this RAC. We will share group norms that will serve as guideposts for our discussion today. And we will briefly go over and review the pieces of legislation that led to the development of these rules and discuss how early engagement around policy concepts were used as the foundation for the rules that will be presented today. The majority of our time will be spent reviewing the proposed rule text, and we will take about a 5-minute break about 60 minutes into the meeting, which one of my peers will just let us know, flag that we will be taking a break. And then we'll conclude the meeting with ways that you can provide additional feedback beyond this RAC. And then the next steps in the rulemaking process themselves. And thanks, folks, for putting your name and in the chat. We really appreciate it. So, what is a RAC? A RAC is a group of internal and external partners, such as yourselves, who come together to help implement rules or administrative rules. And DELC seeks to really get a diverse groups of individuals that interact with the agency and its programs in a multitude of ways. So we really look to engage with childcare providers, the CCR&R, early learning hubs, tribal partners, advocates, and parents and families of young children. So, and that's so welcome and thank you. RAC is a very important part of the rulemaking process. Next, just a little bit about our focus and scope. During this RAC meeting, we hope that you will help us identify if there are any impacts, any unclear rule language, or any resources that DELC can use to provide support to those that are implementing any of these new rules. We ask that you consider if there are any fiscal impacts associated with these new rules, meaning there will be a monetary cost to implement this, whether that's purchasing additional supplies or staffing costs or any other cost to compliance with the rules. For equity impacts, we're looking for any unintended consequences of the rule that may impact specific populations. And we would like your help identifying if there's any rule language that's unclear, or you might not know how to implement the rule as written in your childcare program. And sometimes making new rules may impact other rules. So a lot of rules reference other rules. And we just want to know if you could see or identify any unintended consequences that the way the rule is written that we may need to consider. And then finally, if you can think of as we're going through this, any supports that childcare providers might need to support the implementation of the new regulations, please just let us know. This could be technical assistance forms, it could be templates for childcare providers to use, or other resources that you know of that might support childcare providers. So we like to start each RAC meeting by reviewing some of our standard group norms that will help guide us through our time together and really ground us in the work. Our first group norm is to allow opportunities for all voices to be heard. We kind of think about this as you take space, you speak, and then maybe you make space and allow for others to respond before responding again. And then we ask that you remain focused on the scope of this RAC, which we will be, we had some questions for you on the RAC before or some things to consider. And then when we go through rule content, we'll want you to try to focus on thinking through those lenses of that scope within the rules themselves. If there are questions about implementation that may come up, we may write those down. Al's taking notes for us, and we may follow up with you on a later date as we're really focused on the rule language itself. And then we ask that you be open for respectful discussion, have an open mind and ask clarifying questions to confirm understanding. Encourage and honor all individual perspectives and truths. All of our experiences are valuable and contribute to our shared understanding. Use the raise hand function or the chat for comments. And then again, all comments will be read aloud for transparency. And then we ask that you practice active listening. So listen to understand and give time to reflect before responding. And finally, we're here to seek commonality, that we may disagree, which is okay. It does happen, but that we are all guided by our shared commitment to this work. Next. So now we're going to shift a bit to the background and how we got to this point. And many of you may know this, some of you may not, but in 2021, the Oregon legislature passed 2 laws that were related to the suspension and expulsion in early childhood programs. These laws were created in the response to ongoing concerns about children of color and children with disabilities being removed from childcare at higher rates than their peers. There were 2 bills that became law. One we commonly refer to as the prevention law, which was House Bill 2166. And then this law created the suspension expulsion prevention program, now called Every Child Belongs. And it also established that program. That law also requires licensed or publicly funded early learning programs to contact Every Child Belongs when a young child is facing potential expulsion. So that is one requirement that is in that law. This law also gave the Early Learning Council, which is the DELC's governing body, the authority to adopt rules related to suspension and expulsion prevention, which is why we're here today. We're developing those rules and recommending them for adoption to the Early Learning Council. And these rules will be the focus of the RAC today. The second bill that became law in 2021 is what we call the Prohibition Law. So this was Senate Bill 236, and this law prohibits suspension and expulsion in early childhood care and education programs that are either licensed by DELC or they're receiving public funding through DELC. The prohibition takes effect on July 1 of 2026. And as discussed in the email that you received for this meeting, though this law does exist, so that the prohibition law does exist, DELC does not have the regulatory authority to enforce the statute on behalf of families or take action under current rules for violation of this law. Because of that, there'll be no rules proposed today that prohibit the use of these practices within certified centers or outdoor nature-based programs. And that our focus will really be on preventing these practices, as that is where DELC's regulatory authority does lie. So questions about how this law may impact childcare programs or how programs may be in compliance with this law are really outside of the scope of this RAC. Okay. So we just wanted to briefly also explain how we got to this point. We have been conducting a lot of engagement on what we call policy concepts, which are kind of broad, overarching ideas and about strategies that could prevent suspension and expulsion in early learning programs. This engagement on policy concepts began in fall of 2025. We spoke with advocacy groups and community partners, and 4 concepts really emerged out of that early engagement, which included collaboration and communication with families, connecting with Every Child Belongs to access prevention services. This is also the requirement in House Bill 2166, and creating program policies. And we wanted to also ensure that the new rules, whatever we require, builds upon what we already have existing in childcare licensing rules. DELC worked closely with the Every Child Belongs Advisory Committee. There may be people on this RAC that have participated in that advisory committee. But for folks that don't know, the Every Child Belongs Advisory Committee, whose members include childcare providers, early learning system partners, like members of CCR&Rs or the early learning hubs. There's also community leaders, parents of young children, and regional representatives from across the state. The Every Child Belongs Advisory Committee is dedicated to providing guidance and insight as programs work to ensure equitable access to safe, stable, and developmentally appropriate care for all children, with the ultimate goal of eliminating the use of suspension and expulsion in early care and education programs. We also engaged with the Oregon Partners for Education Justice, which is a cross-cultural network of community-based organizations, culturally specific service providers, and education advocates committed to advancing high-quality, racially just, and community-centered public education systems in Oregon. And then both Oregon Partners for Justice and the Children's Institute were key advocacy groups in the original legislation. So it was really important to engage with them early on. In addition, DELC consulted with the Child Care Provider Union, which is AFSCME, and they represent in-home child care providers who we will be meeting with next week. And then DELC has also initiated consultation with the 9 federally recognized tribes as well. And we have 2 meetings set with different tribes to discuss these rules. And then throughout the engagement, we received valuable feedback on how the rules could be shaped, potential impacts to families and providers, and what supports may be needed to implement the new requirements. Those involved in the initial policy concept engagement will continue to receive updates as rules are developed, and will be invited to participate in additional feedback opportunities, including this RAC. So we just wanted to thank those that helped us in the beginning stages of the rule development. Okay. So now we're going to transition into the reviewing of the rule text itself. If you have a copy, this is where kind of that second screen really comes in handy, and you might want to pull up the emailed copy of what is called the Notice of Proposed Rulemaking. If not, I will be sharing my screen so you will be able to see it yourself, but sometimes it is nice to have a copy to reference. And we are going to focus today on the rules for certified centers. But I just want to note that the rules for outdoor nature-based programs are identical. They are exactly the same. The requirements and the definitions that we're going to go over are exactly the same. The only difference is where it says certified childcare center, it says outdoor nature-based program. So we're just going to go through one rule set for facility rules. And then once we go through the facility rules, we will transition and Katrina Miller will present on the updated definitions to the Early Childhood Suspension and Expulsion Prevention Program rule set. Okay, and I apologize. I am learning how to transition from a PowerPoint presentation to a PDF. So if by chance we get lost, I get lost, I apologize. Okay. Stop sharing. Here we go, escape. Okay. And share again. All right, can folks see the text? Excellent. All right, so we're just going to scroll through this. And again, we're just looking at certified center. But I did also want to point out that as we go through these updated these definitions, these new definitions that have been added, these definitions are really focused on how to implement the rules within this rule set and not the prohibition statute itself. So we're really focused on prevention and what prevention, suspension, expulsion prevention policies look like. And Kat, I see or Julie, sorry, I see you have your hand up. How can I help you?
So I'm just wondering, before we dig into the changes to the actual rules, when I was looking at the justifications and the cost, and
Mm-hmm.
because part of our job is to look at the fiscal responsibility, it talks about that it looks at no significant cost, and I don't think that's accurate.
Okay.
I'm sorry, I work for a Head Start program, and so suspension and expulsion prohibition has been part of Head Start performance standards for 10 years. I have also worked private, and what I know from looking at adaptations that have to happen to support that, it means things like potentially reducing the ratios in the classroom. It means potentially having to buy adaptive equipment to support children who might have sensory needs. It means maybe having to hire additional staff to support those children with very clear behavior plans to provide some one-on-one, because not all children who have behaviors have a diagnosed disability or come with an IFSP. And those things, especially if they're not in place, then lead to staff turnover.
Mm-hmm.
And so that to me was like, oh, I don't know that that's necessarily true. I think there is going to be cost to programs.
Okay. Thank you, Julie. Anything else before we start, Julie? Thank you for that. And I see there's a comment that several folks on here do agree, and they thank you for sharing. Okay. All right. I'm going to scroll. And our first definition, and you'll notice that everything will be renumbered because we add more definitions, things get renumbered. So our first definition is actually the definition of every child belongs, and which is Oregon's Early Childhood Suspension and Expulsion Prevention Initiative. So it's much larger than the rules that we're looking at today, and involves a lot of community partners and regional service providers. And it's our overall effort to eliminate suspension and expulsion. And then Every Child Belongs helps early childhood care and education programs keep children in care by offering timely, responsive support when challenges arise. And I'm just going to pause after each of these in case there's any feedback on that. I see folks squinting. I want to see if I can make it a little bit bigger. There we go. Okay. Yes, Mercedes.
I guess I just want to clarify, if the follow-up meeting will clearly define things like timely and responsive, or if those things are outside the scope of this, committee meeting.
That's a great question. And that is outside the scope of childcare licensing regulations.
Okay. So an unintended consequence of this rule could be potential variation of interpretation of what that means to different providers and across licensing specialists, I would say, I guess.
Okay. Thank you. And I might mispronounce your name. Is it Yazi? Oh, you're on mute.
It's Yessie.
Yazi, thank you.
So I want to address this by offering timely, responsive support when challenges arise piece. Because I happen to know that my region in Southern Oregon has one support person for the whole Jackson and Josephine counties. One lady to offer timely, responsive support when challenges arrive. There are far more than one childcare center and outdoor nature-based programs in our region. And one person doing that job is not setting anyone up for getting or offering timely, responsive support when challenges arise, which they will.
Thank you. Okay, and there is in the chat Mercedes says, I agree, there are more impacts than what Julie mentioned, and unintentional consequences could be to shift the financial burden to small businesses and small programs. I've noted many more fiscal impacts and would be happy to follow up with the list after the meeting. Thank you, Mercedes. And yes, we'll discuss other opportunities where you can share. Okay. So the next definition is expulsion or expel, which means to permanently end a child's enrollment in a certified child care center due to the child's ability, specialized needs, or behavior. Back on this. Alicia.
Hi, yes. My name's Alicia, and I'm from
Alicia.
The Oregon Family to Family Health Information Center in Ocean. And I'm curious, so what does this, what are considered specialized needs? And again, I know this is a definition, but we're kind of curious about what does this look like, and how do they provide support for medical needs? And what does this mean if, for example, a child's participation in this early childhood program is dependent on another adult to be there to support them, either medically or behaviorally, and that adult is not available or present. And so then that child is not able to then attend, or is told not to attend due to that lack of support. And so at what point are we looking at this as an expulsion, and kind of taking, I want to raise this to, as something to look at from some of these other definitions as well, just because I think that that's kind of a theme across the definitions. So I don't know if we have any answers for that, but how are we identifying or specifying what specialized needs are?
So I will say that in licensing regulations, we do have a definition of a child with specific needs. or specialized needs that we could draw from if necessary. I also want to remind us too that the focus of this is not is or is the RAC is prevention. We are not using these definitions do not define the prohibition. So only the prevention rules. So we're looking to prevent the use of expulsion. But that doesn't quite address your specialized need or your doesn't fully answer your question. And I recognize that, Alicia.
Right, and I'm thinking of this as a prevention
Okay.
piece because what I'm thinking about is that lack of support within the space, and how do we prevent expulsion of a child that's already attending if the support is not in place, is not available. So I guess when I'm thinking of specialized needs, and I'm thinking also from the medical side as far as nursing or other medical care that is being provided, when those professionals are not able, or professionals or paraprofessionals are not able to attend, then the child can't attend. And at what point are we looking at this being an expulsion or suspension even, right?
Yeah.
And that's why I said it kind of, goes across some other factors. So
Yeah, Alicia, I do not have an answer to that question today, but I will say that Al will note that as something that we may need to consider. Do you have suggestions on how we could, because those are very specific situations again, and we do also require compliance with ADA, which is another consideration that I think you have brought up as well. But if we are looking at suggestions, so if there's a suggestion for the changing the definition of expulsion, or is this more around like implementation and what does it look like? And you're on mute, Alicia.
sorry about that. Implementation specifically, or even again, I don't know if this would include like a subtext of, with the caveat of the lack of support when, when support's not available. So I don't have the language readily in my mind, but
Okay,
yeah.
thank you. Julie?
So piggybacking on what Alicia said, I think that there's two things here that come to mind for me, and that is not necessarily expulsion, but that concept of soft suspension, and that often we do have children who come in on an IFSP, and part of their IFSP is a reduced day because of concerns related to their IFSP success for the child. And so in the world of Head Start, like when it's written into the IFSP, that doesn't meet the criteria of being considered as expulsion or suspension because it's a very specific plan. And then there's things that go in place to build skills, capacity, etc. And I didn't feel like I think to Alicia's point that it's as clear in this of what that could potentially look like. I think also that we have had some situations with some children who have had some very significant health needs and that require training from like a nurse consultant in how to administer for a child who maybe is diabetic or has some kind of pump or like I said, some very serious health considerations that we can't serve the child safely until we've had training and then finding access to that piece. And so then it becomes, I think, for programs, the concern of, well, are we excluding the child because we're not able to serve them until we have this in place? But to do that, to do it appropriately, we need to have these things in place for the child's well-being. And so I think that that's where that, like, I think that maybe, and maybe I might be wrong, Alicia, but kind of trying to clarify where those exceptions maybe are for when this is not going to apply. Because I did see that, like, here's the health things in the rules. I do remember reading that on what they consider specialized needs, but I think it's a little maybe too broad. So maybe having some language that really does give programs that breathing space of, you are doing these things to meet all children's needs to the best of your ability.
Okay. Cynthia. Thank you, Julie.
Yes, thank you, Julie. And we've had a couple items put in the chat as well, kind of going back onto this same, in addition to this topic. Didn't know if you wanted me to read those out, Abby.
Oh, sure, please.
Okay. So we had one from Jaya about the timeline for IFSPs in the Portland area, kind of being a lengthy process of up to 6 months minimum. So taking that into consideration, another comment around effective prevention depending on timely access of the support, kind of also going in line with what has also been shared. And then maybe using this as a way to focus in on, in our text, what should account for whether the supports are available and available early enough to prevent escalation. Yeah, and then we also have some agreement with what Julie had shared. And then Mercedes also put in their thoughts around that this will not prevent the soft expulsion, and that knowing that it is accounted for later in the packet, and so that we will be touching on that later. But is this a good place to add language in the rules around the soft expulsion? And then Kim shared, I don't think the definition is expelling a child due to medical needs.
Medical needs. Yeah. Thank you. I want to keep us on time. There's a lot of good feedback. And I really just, we have a lot to get through. And so I'm going to try to keep us on time. And also just know that there are other ways to provide feedback too, besides the RAC, if we don't by chance get to your comments. Heather.
Just really quickly, appreciate a lot of the comments, particularly in the beginning, around timely and responsive. I just want to echo what everybody's already saying about that. I do want to just call out the use of the word child's ability in the definition for expulsion, and just be really careful about using the word ability in there. I don't actually have and I think we've already talked about potentially that could be inconsistent with ADA. Also, if we're looking at IDEA too, but that ability word and how that can be used as a measurement is a little bit concerning as a word. I'm not really, I would have to think about a little bit more about what a recommendation would be for that, but that is a little bit concerning in language around expulsion.
Okay. Thank you, Heather. I see there's also another chat that just said that Eric is asking, as the definition of expulsion and expel, is there a reason that race, gender, etc. was not included, although research shows that as a factor? We did not. We can take that down as a note. Okay. All right. The next new definition is potential expulsion. And the reason that we are defining this is that it is within the requirements of the prevention bill. It says that a child care provider must contact every child belongs when a child is facing potential expulsion. So we chose to define potential expulsion, or at least identify indicators of potential expulsion. So it is currently defined as refers to the risk of a child being expelled permanently from a certified child care center. Indicators of potential expulsion include, but are not limited to, the use of strategies identified in the program's behavior and guidance policy without reducing or eliminating the challenging behavior, and the use of temporary safety-based intervention, which we will go over at, that is another definition. And then, or the use of physical restraint on a child more than once. We do have rules on physical restraint. Any other indicators of potential expulsion folks may find or have experienced that we might help add? And Melly, see your hand
I
up.
just have how's my audio? Am I okay?
You are good.
Okay. So I'm just concerned about the idea of the potential. Like, what are the measures being utilized to even consider that aspect?
Mhm.
I mean, go ahead.
These are indicators, and I will say that it is difficult to define potential because we can't see what somebody's thoughts are, or
Right.
so we're just trying to identify potential indicators, and so that's why those are listed. So I agree, though, Melly, it is difficult to, you can't really read someone's intentions.
Right. So is it possible to put a note in that? As in fact, as also because of reframing can help in the observer's, interpretation of what they're seeing. And we don't know if that individual has been introduced to reframing in just observing the behavior and the circumstances around it instead of making a conclusion.
Reframing of
The moment, the
the
situation.
moment.
Mm-hmm.
Oh, I'm not sure. I might not be fully understanding Melly's comment. I'm not sure if other of my Delk folks, I might need to be reframe that.
I
Have
can
that reframed for me.
I can send something. It
Okay.
has to do with the fact that you're on the outside looking in instead of being reactive and
Okay.
making assumption to the
Thank you.
circumstance that you're witnessing.
Yes. Thank you, Melly. All right. We have other folks who've raised their hands. Robin?
I think I know we're just in definitions. I think as far as physical restraint goes and with the child on more than one occasion, I always think there's an opportunity to talk about what does physical restraint mean. We do a lot of that with some of our childcare that we work with. And there's a lot of like moving a child against their will. And, like, what does that really mean in physical restraint? Because we do a lot of definitions around that, and maybe having some more guidance on physical restraint would be helpful.
Yeah. And we do have a definition of physical restraint in childcare licensing rules and an entire section on physical restraint as well. So, Robin, I don't know if when we get to those, if that provides you with what you need, but if you think we need more,
yeah, I was
let
just
us know.
referring. Yeah, and what I did is just look at the definitions that's included within this right above it of physical restraint, and think it still is not definitive enough. So that's where I was pulling it from.
Okay. All right. Is it Jaya?
Hi, thank you.
You're welcome.
Can you hear me okay?
We can.
Okay. When I read this the other day, the first thing that struck my mind was here we're trying to make language around that not doing expulsion and suspension, and then you're using the word potential expulsion in a definition. Seemed kind of like odd to me because it's so I just was curious on the language selection for that. Are the programs allowed to expel children or not? And if they aren't, why would you even say potential expulsion in the language?
We used, well, technically there is a law that bans suspension and expulsion in starting July 1 of 2026. But our childcare licensing rules are not intended to be used to enforce that ban, because we do not have that ban, or we do not have authority to enforce the ban. The word potential is used because that is what is used in statute. So we had to try to define that because we need some way to enforce that childcare programs are contacting Every Child Belongs when a young child is at risk of, or facing, I think is the word, facing potential expulsion. So we had to define it in some way or produce indicators to help with enforcement of that piece. There are notes in the chat that oh, lots of notes in the chat. So I wonder if, let's see here. I wonder if ability will make issues for children who are not potty trained at a center, which requires a child to be potty trained as per certification. We have children who had to take time off to get more potty ready and return. And then ongoing family meetings to discuss behavior concerns. Oh, is that maybe a suggestion for a indicator for potential expulsion? I'm wondering.
Yes, that's how it was
Yes, oh, great.
intended.
Thank you. Thanks for that suggestion. I think that this is a place where there may be some ambiguity and unintended consequences could be over triggering. The rule requires each center to decide in its own policy when staff must seek support, how the center determines additional supports are needed, and then when the center will request ECB. If those thresholds are mostly local, programs may interpret the same child behavior very differently from one site to another. Clear criteria for what is considered potential expulsion, i.e. what do programs have to do in specific, and what do programs have to do and demonstrate specifically? Is that Julie, is that a question or is that just a thought on what an indicator?
It's just a thought that I in this section of like if we were to be more specific. So if you're going to say that you've used the strategies. So for example, in our program, we have very clear plans. We have a flow chart of like, this is the process, behavior tracking, etc. And so we have like criteria of like, you have to have documented the behavior for at least 2 weeks. And then we have systems in place, right? And so, and then if we've suggested something, you have to show that you've implemented those suggestions with fidelity for X amount of time. And so with this piece, kind of like what Mercedes, I think it was Mercedes was saying, is that I think because it just says the use of strategies, who's like, and it's defined by the program, but the program might decide that they tried timeout and it didn't work. So now we're going to expel the child, as opposed to using conscious discipline or positive behavior interventions and supports, or having a more comprehensive type of system. And that's part of one of the other fiscal things that will come out of this, if we are really expecting programs to be successful in implementing strategies, then there has to be training and there has to be time for that. And if you're a private, I mean, we are fortunate in Head Start that we have a training budget and we have some time carved out. But private facilities, when I worked private, we did not have the access to that. You were lucky if you could get a Saturday training. And so how are we going to then train private facilities, licensed facilities, adequately? Because like PBIS is hours of training. Conscious discipline is hours of training. And I know that there's trainings out there that are provided by the CCR&R and other agencies, but that's a huge time commitment, which then creates a financial burden for small private centers in particular.
Thank you, Julie, for clarifying. Yessie?
Yeah, I think that if we are planning on defining what potential expulsion or suspension looks like, it needs to be a really clear definition that is based on like implementing evidence-based strategies, not just like like Julie was saying, so one center's plan is to try timeouts and then try quiet corner, or send them outside or give them a hug or something like that. Those aren't like evidence-based practices for helping children through challenging behaviors or big feelings. That's not the same. And so letting it be up to each facility to decide what their strategies are, I don't think that's a good plan of action. We should be lining it up. If you've tried this evidence-based strategy, this evidence-based strategy, and they're still having behaviors, then we're looking at potential expulsion or suspension.
Thank you, Yessie. There are a lot of comments in the chat. Melly, I think that adding the word facing would indicate there are processes which need to be evaluated prior to, oh, we tried A, and that didn't work. Heather, I do wonder about the words challenging behavior. Centers may define challenging behavior narrowly or broadly. Behavior at one center is considered challenging may be typical developmental behavior. And then Jaya, I think the idea would be to connect with supports before the program got to the stage of facing expulsion. So ECB only is for more crisis situations. Also, teachers have different abilities, and senior teachers can handle situations more skillfully than a new teacher. Crisis for one classroom may look different for another. And those, Julie says, and those training and support of evidence-based strategies might be one of the supports that come from DELC. So options to reach out way before potential expulsion so that we can truly prevent. All right. Great conversation. Cynthia?
There was just one other comment that I
Oh,
wanted
did I
to
miss?
noted.
Okay.
Yeah, it's okay.
Okay.
Was around that it might be a bit of a double oversight for Head Start programs that already have process in place around suspension and expulsion and steps that have been taken. So just wanted to make sure that was noted.
Thank you. Okay. So
just a time check. Just
yeah, I know.
We are almost 10 of 4 o'clock.
Yes. And we have a lot to get through, and I might have to push us significantly quicker than we probably want. So the next definition is serious safety threat, which refers to a child's behavior that presents a danger to physical safety of themselves or others, which cannot be reduced or eliminated by the program's existing guidance and behavior strategies. And this definition comes into play when we talk about what we have termed a temporary safety-based intervention. Okay, Julie?
I'll be quick, I promise. So this is another area I think that it's pretty broad, and there might need to be some clarity around represents a danger to the physical safety, because if you have toddlers, they're going to throw, right? Like that's what they do. And so really it's not like a one-time incident. There needs to be something in here around maybe not developmental. So we're taking into consideration ability and the developmental stage of a child, and that like somebody talked about the definition of challenging behavior, of it has to be something that persists over time. And so while this does say which cannot be reduced or eliminated by practices, I think that there needs to be something in there that provides, we're not talking about like a one-time incident.
Thank you, Julie. Jessie?
Yeah, I just want to, I run an outdoor nature-based program, and there are certain behaviors that in an outdoor setting can be more like present a higher serious safety threat. And so they may need to be handled differently than an indoor center might. A child eloping from an indoor center who has doors and fences and things like that is different than a child eloping near a creek in the wilderness. So that I don't know how the definition could be expanded upon to state that it's the space, that's there's specific considerations, or if in the ONB rules, there needs to be an additional safety threat situation, because also if you have children eloping in an outdoor environment, then you have staff who need to go locate said child, and then you have additional children in a safety threat because we have to have somebody out of radio communication potentially to find the child who may go missing. So just there's additional concerns within that space.
Thank you, Yessie. Okay. I'm going to move us on to suspension, which is the reductions in the amount of time a young child may be in attendance of a certified child care center, such as requiring a child to cease attendance for a temporary period of time, except if in connection to a temporary safety-based interventions, which is the next definition, or reducing the number of days or hours that a child may attend due to the child's ability, specialized need, or behavior. I imagine we might have some similar feedback around those three things: child's ability, specialized need, or behavior, that we had with expulsion, since they appear here again. Okay. Alicia.
I'm wondering if I can kind of make a comment that is including suspension and temporary safety-based intervention, because I'm having a little bit of a hard time with the separation of the two. I'm concerned about temporarily removing someone from a temporary, to provide a temporary safety-based intervention. We don't know how long that's going to take, right? And so they may be out for weeks potentially. And how is that different from a suspension that's due to behavior? And a suspension, does that mean that there is no, if there is a suspension, there is no active work being done to create a temporary safety-based intervention or work towards other interventions during a suspension, as there is during a temporary safety-based intervention? So there's just a little confusion there for me.
Okay. I don't know if it helps when we get to the temporary safety-based intervention and how it can be used, when it can be used, and what has to happen during that time period, and how we have chosen to define it differently than suspension. We based it somewhat off of what the Head Start performance standards are, in terms of the time is to be spent. The ultimate goal is to return the child to the program as quickly as possible with supports in place. And there is no timeline on that, because to others' concerns about timely and implementation of services and supports, because we don't know. And we can only hold a program accountable to what they have control over too. So that's why there's no timeline in there, but it is to be such a period that until supports are in place, and the intent is that the child is coming back to the program. We have, okay.
So are you saying the intent is the intent not also for them to come back during a suspension? Or wouldn't they be on?
So we're in the licensing definitions, a temporary safety-based intervention is not a suspension. It is a period of time, and that is done on purpose. So it is not in a suspension. It is outside of suspension.
Yeah, no, I understand that. I guess I'm just trying to really wrap my head around the difference in when someone is suspended, what is happening during that time when that child is out? Are we saying that there is no safety-based intervention being planned during a suspension?
During a safety-based intervention, the program is supposed to be seeking support, yes, and to put supports in place to have the child come back to care.
But not for a suspension. They are not required to be seeking support during that time.
That's what I'm
asking.
yes, if a suspension occurs, there is no requirement that they are seeking support currently in licensing rule. Okay. Oh, sorry. Someone else, Heather.
Yeah, I just want to acknowledge it's really challenging to be trying to take these sort of like each one separately without the big picture. When I see 22% of kids who are who have a disability are, that we're seeing suspension and expulsion at a higher rate. The piece for me that keeps coming back is like I keep trying to keep this separate, but the reality is that when we're looking at IFSPs, and somebody mentioned in the chat around how we could maybe do some things in between stabilization to prevent getting to a suspension. And I guess that for me, I just have to call it out. It's the through line that trying to take this just very specific in the wording without really thinking about what the interplay between ADA and IDEA looks like, considering that the students who have been the most impacted are students with disabilities, is I think what's tripping, I'm just going to call it out, what's kind of tripping me up a little bit in trying to just acknowledge where are the places where I'm automatically putting in what I believe would be happening when there is that intersection of a child that has a disability. So I think I just need to call it out because I know that I'm feeling tripped up frequently as we're kind of going through these.
Thank you, Heather. I'm going to read the chat and then Julie, so because I don't want to lose our place in the chat here. Uh-oh. Maybe I did. Oh, right there. Okay. And those trainings and support evidence-based, I'm not sure, did we get there? Potential expulsion we could truly prevent. This is where I was talking about what is written in IFSP. Kelly says sometimes modifying a child's day while bringing in supports avoids expulsion. With the return to the program, there should be a requirement that clear indicators for increasing time. Agree that clear steps for increasing time to indicate that there is a plan to support versus moving towards expulsion or sending a negative message to the family so that they opt to leave, which could be considered a soft expulsion. And Melly says, it seems that there is a need for a footnote clarification. The terms temporary removing a young child, there has to be an algorithm to these steps. Okay, Julie?
So going kind of off of what Heather said in looking at children with IFSPs, part of my concern is in many of our areas, we serve 3 counties, and the ESD has moved primarily to a consult model. And so we have had children who actually had one-on-one written into their IFSP, but there's no support for them. And so then they have an IFSP. They have things in place to support them in being successful in the classroom, but they're not getting those services. And then it creates safety concerns in classrooms because we don't have the staffing support, et cetera, that the child actually needs that's written into their plan. And so I think, Heather, kind of thinking about what you were saying of like that intersection of we're doing everything we can, but here is a diagnosis, here is a plan to support the child, and those services aren't happening for a variety of reasons. And so, and then we have actually had children who have a diagnosed disability, we have put things in place to avoid them being suspended or expelled from our environment, and then they go to public school and they get expelled. And that creates a really hard ship for families. And I know we don't have control over a public school system, but.
Thank you, Julie. Okay. I'm going to have us do this one last definition and then take a break. So we have defined young child, and young child is used in the law. And we define young child as any child who is 6 weeks of age until eligible to enroll in kindergarten on or before the first day of the current school year. So when you see the term young child in the suspension and expulsion prevention rules, that refers to children that are infants, 6 weeks, up until they are eligible for kindergarten, which is also how a school-age child is defined in statute. Notes on this. Okay, it is right at 4 o'clock. So we're going to take a 4-minute break. I'm going to pause the recording, and so please come back at 4:05. All right, welcome back. For those, we're going to jump right in because we want to hopefully get out on time today. There was an additional comment here in the chat that says that Jaya agrees with Julie. It can look good on paper, but the services are not as available as needs present. Also, I don't see anything in these rules that that note the partnership of families or guardians. For example, we need parents' consent for evaluation. Thank you. Thank you. All right. We are transitioning from definitions into actual requirements. And the first change to the requirements is that I'll just read the top portion of this rule, which is that a center must have written policies identified in this section and provide them to staff, volunteers, and parents at the time of a child's enrollment. And they also need to be notified when these policies change. The additional policy that must be added or given to parents and staff is the suspension and expulsion prevention policy. And then we will reference this later on. And yes, Shannon, I see you have a hand raised.
Yeah, I just, you mentioned earlier that suggestions would be helpful. And so I think when we're talking about writing new policies, I think templates would be super helpful, as well as support for the CCR&Rs so that they have clear expectations so that they can support providers in writing these policies if necessary.
Yes. Thank you, Shannon. That is definitely one that is on our radar as well. Yeah. Built so that they can be in compliance with the rule as well as thinking about best practice too. So, okay. Any other feedback on this? Okay. All right. We have made adjustments to an existing rule to also add that a certified center must be in compliance with the suspension and expulsion prevention rules as well. The changes to Section 6 are that a certified center must complete an individual assessment of a child known to have specific needs, which are defined, before determining whether the center can meet the child's care needs in its program. So that is the pieces that have changed, along with, and then the evaluation must include these 3 components. And then if it is a young child, again, infant through preschool age, documentation that the center has complied with all of and these are the suspension expulsion prevention rules, which actually I think are coming up here shortly. So, Julie.
Yes, in this section, my question would be, or clarification that I think is needed, is it talks about certified center personnel. And so is there going to be a requirement that it has to be like a designated person that is doing this assessment? Can it just be the teacher? Is there any kind of criteria or qualifications in doing this assessment? Because I think we've already talked about kind of the lens and the view and how one person might interpret something is very different. And so if they're really not looking at this with a really broad child development lens and looking at all the things, I think that that there's the potential for that assessment to not necessarily be as useful or as accurate that it might actually support, oh no, we're gonna like we gotta do some things for this kid.
Thank you, Julie. So your suggestion is to better define personnel or put requirements on who that is. Okay, I'm not sure who was next. So I'm just going to go down the list. Tiffany.
Yeah, I was curious too, just for clarification. When I first read it, I was thinking of going through the IFSP process, but this is saying more about the child care centers policy and going through an assessment. And what would that look like as far as what types of assessments and what kind of qualifications do you have to have in order to do those assessments? Just kind of some more clarity, I guess.
Some more clarity around assessments. Alicia.
Sorry, I was having a hard time with my
It's okay.
mute. Let's see. I think actually I'm gonna pass on this. Never mind. I think I got my
Okay.
question answered.
Okay. Yessie.
So I think if we are going to say that a center must complete an individualized assessment, it should be something that is provided to them. Like what all centers should be sort of looking at least a few core things that DELC has decided need to be within that. So this would be another place for a good assessment tool so that we get it across the state. Everyone's doing their complete assessment before the child enrolls, and we're kind of looking for all the blind spots or whatever.
Thank you, Yessie. Heather.
Yeah, the individualized assessments, that was an area that I wondered about too. My other question was around the word child known to have specific needs, and just wanted to clarify that we don't, that we're careful about like a disclosure burden from families. We want to be really careful that we're not, we would always encourage families to provide information that's going to be helpful to their child's learning. And also, what we don't want to have is that there's pressure to disclose when a family doesn't choose to disclose, and that being a condition which could also cause some issues around ADA and yeah.
Thank you, Heather. Cynthia.
We had some items placed in the chat around just having a better definition of assessment. And then also Tiffany shared that there's a difference between screener and assessment, and that can often be confusing. And Teresa said a clear assessment will be key, but there can be exception thinking of Head Start. Already, they have tools in place that meet federal regulations and have passed reviews.
Thank you, Teresa. Katrina.
Correct me if this, I think we missed one, but correct me if we actually did cover this. Which is Erica says, I think I understand that the bills passed are specific to early childhood, but since these rules will be in certified center licensing and affect center policies, is it safe to imply that this could include school-aged children?
Which part would include school-aged children? That's my question.
Well, and I can come off mute real quick.
Sure, thanks.
So I think if I was a center director and I'm looking at these applying to potential changes in policies and process, but I also accept children up to 12 into my program, then I think I would be implying that this would also include school age, even though the bill doesn't necessarily mention that. So I'm just wondering if there's considerations on that process, and if we are just supporting providers and being inclusive of all children regardless of age, or just kind of some of that potential language that may come up if they serve children up to 12.
Yeah. There are specific rules that I state young child, so that they are really for specific to young non-school age children. Generally speaking, most of our licensing rules apply to all ages of children. But the House Bill 2166 in particular, the one that requires um, providers call every child belongs, does state young children. So providers will only be required and this is only when they're required to contact every child belongs when a young child is facing potential expulsion. But you will see that some of these rules are general for all children, and the expectation is that they're implementing them for all children. Okay, the next section is around items available for review. So these are the things that must be available at the center for parents and members of the public to review. And the thing that has been added is just the center's suspension and expulsion prevention policy. So they must have this available for review on site. I see there's a comment. It's currently young children are being suspended or expelled at a rate 3 times higher than K through 12 kiddos. Thank you for that context, Kelly. Kim. Oh, did the hand go down?
Kim, you're muted. We can't hear you.
Okay. Nope. Kim?
Kim, you were on mute, so we didn't.
Yeah, yep.
Oh, shoot. I was already going to the next one.
Okay.
I had just asked the items available to view, just clarity. It can be in the parent handbook. It doesn't have to be posted on a bulletin board as for licensing or anything like that as of yet, correct?
Correct. Must have the following items available in a prominent and frequently visited location.
Okay, so then it does have to be.
It's flexible. It's intended to this one says post, number 1 says post, so you have to post all of the complaint and non-compliance letters.
Right.
This is, we often call this the binder rule. Like folks can have a whole bunch of things in a binder that is at the front location or where your parent information board is. So there's no change. This is just something that has to be included in the binder as an example.
But it could go in the parent handbook and cover that rule, right?
As long as it's available on site.
Okay, perfect. Thank you.
You're welcome. Okay, notifications. So this includes notifications to CCLD as well as notifications to families. There is a question in the chat. Heather says, just to clarify what I was going to say, programs cannot require disclosure of a disability as a condition of enrollment. I'm wondering if known meant known to the center, known to the family, known to the professional, formally diagnosed, informally observed, and then I'm guessing it's all of these things. So it sounds like we would like some clarification on known. Okay. So notifications. So a certified center is required to notify CCLD by 5 p.m. the next visit or next business day of all of these things, which the addition is the implementation of a temporary safety-based intervention. So if a program is implementing a temporary safety-based intervention, they have to notify CCLD by 5 p.m. the next day. And we will just be documenting this in our system and following up with the provider. The next notification requirement is in relation to notifying the family or an emergency contact. And this is, they must be notified immediately, is if a child exhibits behaviors that require the use of a temporary safety-based intervention. So Heather?
Just a quick clarification. This is probably in practice, but communicating with families, I noticed that the percentage of families that were most impacted spoke language other than English. And so just wanting to call out, like, do we have somewhere procedurally or within here around notifications, making sure that they're in a family's language?
Primary language. That is not in licensing rule at this time, but we
Okay.
can take that feedback. Okay. I'm going to move us right along. So this is, as we referenced before, the use of physical restraint is an indicator of potential expulsion. So under the physical restraint section, it is being amended to state that if not previously done so, a certified center must contact every child belongs if physical restraint is used more than once on a specific child, a specific young child. Yes, Julie?
So while it does kind of lay out what physical restraint can and cannot be, my concern about this is that there's really not anywhere in this around training, and because there are appropriate ways that if you have to do restraint, it like not best practice and recognizing for a child who is neurodiverse that it actually can be physically painful, like trauma, but like if we have to do this, I don't see any criteria that staff should be trained before doing, and that's a concern for me.
Thank you, Julie. Robin?
Yeah, I'd reiterate what Julie says about just what is physical restraint, what does that mean? So just maybe more technical assistance or training on what that means. And then also I always worry about the like must do this before, because it sets up this precedence of like here's this checkbox, and like the supports that every child is intended to have within, infant mental health consultant is supposed to be a process that is this, that they want to be engaged in and involved in. And so I understand the spirit of the need to want them to engage in that, but it's also the relationship between a mental health consultant and a child care provider is is of that supportive role. And if they feel like this is one of the things I need to do, I must do it, it creates a dynamic that makes that consultation difficult.
Thank you, Robin. So there are some things in the chat. So sorry, I'm guessing it's all of these. Okay, Kim says, Julie, there's training available in our area, and she apologizes that your area may not have that training. Melly says there is no protocol. I'm not exactly sure what that's in reference to. I don't know if you want to elaborate.
Yeah, it's in reference to the word if. If can be anything. It's so open there on number 7, if not done previously. So there's a lot of situation where if physical restraints is used, it shouldn't, I mean, you don't want it to happen, of course, but where is the parameter around that? It's so open-ended that it leaves people to only go by their own assumption again. So that's my concern.
Okay. Thank you. Katrina?
Melly, I just wanted to clarify, if refers to if every child belongs hasn't yet been contacted, rather than a reference to use of restraint.
Yes, I read the comments you said there, but that was what it was about.
Thank you, Katrina. And thank you, Melly. So Kelly says, contact every child belongs, however, with what exception?
Expectation.
Oh, expectation. I'm not exactly sure. Kelly, do you have more to say on that?
Yeah, so I'm just wondering, it's not clear. Do they contact Every Child Belongs to require services to help with the safety restraint? Do they contact Every Child Belongs just to get a consultant? Do they contact just it doesn't explain. Someone could just contact and say, "Hey, I'm checking the box." So that's what they told me to do. And so I just didn't want it to be used that way. And so maybe
Okay.
just some explanation around that.
Okay. Thank you for that feedback, Kelly. So Mercedes says the rules add written policy requirements, documentation of behavior triggers at reporting to CCLD, written plans for repeated restraint. An unintended consequence could be that programs spend more time documenting crisis than actually stabilizing classrooms, especially since DILS also says it expects only minimum compliance costs. And Kelly also says that she agrees. Sorry, Delk. Thanks, Mercedes.
Sorry.
It's okay.
Remember CCLD?
It's all right. It's all right. Okay, next section. This is kind of the beefy one. And we only have 35 minutes and Katrina still has to go. So the next section, this is a whole new section. Everything in here is new. This is all about suspension and expulsion prevention. A lot of the definitions that you saw previously or a lot of the definitions you saw previously are used here. And so I'm going to ask that Al, our note taker, is going to drop some of those definitions into the chat so we don't have to scroll up and down. And this might also help with some of those definitions, those questions and concerns that came up around the definition. So a certified center must develop and implement a suspension and expulsion prevention policy. The policy must be consistent with their established behavior and guidance policy, and this references our behavior and guidance policy requirements. It must identify existing center supports or tools that may be accessed. So they would identify, maybe they use the ASQ, maybe they have other tools or access to behavior specialists on site. So those would need to be identified by the program. And then identify when and how classroom staff will seek support when challenges arise. And then including with that is when and in what circumstances classroom staff must seek support. And then how the director or the designated center personnel, in case it's someone else, will respond to the request for support. And what internal center supports will be made available to classroom staff. I'm going to get through all these. Identify how the certified center will determine if additional supports are needed. So it's sort of maybe informal or non-formal assessment or after a series of documentation, a time period as I believe, I can't remember who that was or spoke to earlier, Julie, I believe did. Identifying when the certified center will request services from Every Child Belongs. That's if before it's required. So we heard extensively in engagement, and we also heard in this RAC today that we want folks to access Every Child Belongs and supports before you get to the point where your expulsion is even an option. So this is an opportunity for programs to identify that they want to contact earlier. And then include a method as to how the certified center will notify family of concerns about a child's ability, behavior, or development, such as written notification or parent or in-person conference. So how they're determining how they are best communicating with the family about concerns that do arise. So I'm going to stop there because those are what has to be in the policy. And thank you, Al, for dropping those definitions in the chat.
Very sorry for the delay.
So I see that getting support for the new policy would be really helpful. Maybe an example of what a policy could look like. And Julie says, my biggest concern is in this section is for programs that already have many of these things in place. For example, have a behavior support staff and classroom as part of their program efforts to address already. So to say we must reach out could possibly take services and supports away from a center that needs those supports. Julie, I think this is being addressed in a different group. And I would encourage you or your organization to reach out to folks at Every Child Belongs DELC for more on that. So, because we hear you, Julie. Okay, I'm going to move us along to this next part about, okay, so this is when a young child, so again, infant through preschool, is facing potential expulsion, as we've defined it, the indicators earlier. A certified center must document the challenging behaviors and any known triggers. So we're asking for some documentation, hopefully not over documentation. But they're looking at when this is happening to really see for those patterns. And then they're documenting the strategies they use to support and their effectiveness. So what have they tried and did it work and did it not work? They are also, again, since they're facing potential expulsion, they're requesting services from Every Child Belongs. And then at the same time, they're requesting services, they're notifying the family regarding the behavior concerns. And when they're notifying the family, the intention is that they're going to begin to collaboratively problem solve to identify strategies or supports for the child. And then they're going to establish a frequency and method of ongoing communication. So again, it's collaborating with the family and communicating with the family. So, and then there is, though, if a certified center is unable to contact the child's family as outlined in these rules, the center must attempt alternative methods of communication and document those attempts. So this is something that we heard from childcare providers, is that sometimes they don't hear back from families when they're trying to make contact. So we just wanted to make sure that they are attempting other forms of communication and that they're documenting those attempts. Five right here. Oh, Jaya, yes.
Hi, I'm just wondering, actually, I've been at the center I'm at for 20 years now. And
congratulations.
Thank you. And in the classroom. Many of the teachers I've worked with have not made it through that long for different reasons. And a lot of times it is the stress of these kind of situations. What is the plan for programs that just don't have a lot of bandwidth with supports within their programs? Like, we can actually write all these things, but I'm just wondering what is the reality of, we could say, oh, the director's going to do this and then this, but someone's sick and the cook didn't come in that day. I'm just really wondering how these policies are going to be able to put into practice I want it to happen, but I don't see any clauses for this is ideal what the centers are trying to do, but anyone who's worked in childcare knows that you have your best goals, and then there's the situations of a new teacher has just started, or and they're just trying to figure out learning songs for the children, and they don't that supports have been a little less. I would like to think of some language. Maybe people could help put some language in here. And then the other thing was just that in the many years I've been here, most of the times when a child has been not successful in our program, or it's been really stressful for the teachers, we've had them, but it's been hard, is along the lines with the response from the families, or sometimes even the family culture around behaviors. And I just wonder, I don't see anything in place that has anything that talks about what the families could, how they have to support it. Or is that something different? Like, we have our own personal policies and that's not considered expulsion. It's if your child has these behaviors, then we require you to come to meetings with us. And if you're not doing that, it's not like the child's not successful, but there's always this like balance of child success and then like the family success. Because the parents are really the child's first teachers, and they're, we try to support. I mean, I don't think any program feels good if a child is asked to leave their program. And so just wanted to say, I just don't really see anything in here in that. And I would like this group to think of how could these small things be added into the policies language.
Thank you, Jaya.
Like, one last thing. Like, does the family, the other thing that I've come across recently is that all of these things that you're asking us to do also depends on the parent's consent. So, like, I can't get an IFSP for a child if the parents don't sign on to that. So I don't know if that's going to be different about the Every Child Belongs organization, but there are circumstances when the parents are also concerned for, like, I had a parent that said, I don't want a label on my child. I'm concerned if they get labeled as autistic. There's still a lot of fear around parents around that. So I'm sorry I took so long, but thank you for listening.
You're welcome, and thank you. And there's appreciation for your transparency in the chat as well. I will say that licensing rules are really focused on what childcare providers must do, and we can't force parents to do, or DELC can't write a rule to force a parent to do something. So that's why there's not a lot of we can't put requirements on parents, but I do hear your concerns about, well, if parents don't want to collaborate with us or don't want to have an assessment completed because there's a lot of fear or concern around that. And when we hear that, and hopefully like supports like Every Child Belongs can help childcare providers work with families on addressing those fears. I don't want to speak to Katrina's, initiative, but I know that is one aspect of it, right? Is that family collaboration. Alicia.
Yeah, hi. I just want to say that I want us to be careful around the requirement of what families are or are not required to provide or do within this, because this is around the supports that are necessary and needed within the space. And so I wanted to highlight that it's really important that we are thinking of the possibilities that can be supportive of a child outside of just getting an IFSP or just getting access to services that may not be the appropriate services for them. So I think that it's important that we have family input and buy-in when possible, but it's really important that we're focusing on the child and the providers in the space that are as we're looking at the policy pieces of it, because it's going to be really it's already a challenging environment for the parent, and if we're going to require things of the parents, I think that's going to be really detrimental to the building of the relationship within the childcare. So I think we just need to be careful of that. And I'm curious, where are we in this? Because I've read ahead a little bit. Now I had a comment, but I don't think we're on that part yet.
We're in 5. So we're just starting 5. So it's okay. Okay. So, and there are just comments in the chat too, just about how family dynamics and cultural considerations within communication differentiation may be included language here. And that there needs to be something about parent buy-in. If they're not being helpful, it may tie the hands of providers as well. Okay, so this section 5 is about implementing a temporary safety-based intervention if a child's behavior creates a serious safety threat. So again, those definitions have been dropped into the chat for you to reference. And then 6 describes what they must do if they are implementing, or when they can use a temporary safety-based intervention. And that's only when the behavior, there is behavior that meets the definition of serious safety threat, and the center must document that behavior. and that the certified center has attempted to address the behavior through strategies outlined in their policy, strategies suggested by the family, and any recommendations from professionals previously consulted about the child. So in order to implement a temporary safety-based intervention, a program must go through several things, or try multiple strategies, and consulting with the family and other professionals. So, and Alicia, I see your hand is up. Are we on that part now, or are we okay?
Yeah, I'm curious about, I'm going back to definitions within this, and within the safety-based or temporary safety-based intervention. I, does this mean, because I see this thing about kind of like previously trying other things, does this mean that the parent is required to have that knowledge of this behavior ahead of time? Or, how are we involving parents within that process? And kind of to the point of what was said earlier, if the parent does not approve of a temporary safety-based intervention, or is not on board with it, then what happens within that process?
We have not outlined what if a family does not agree with the temporary safety-based intervention.
Okay.
So there would be a suggestion to write rules or write requirements around that. And it does not require that there is a requirement that they are when that the program is communicating with the parent when there is potential for expulsion. And then so they might not all be connected, but I see your point here and maybe we need to address this piece here, because this B here is making the assumption that they have already communicated with families and they're about this. So we will go back through and look to see if that sequence of events aligns.
Okay.
Alicia,
that's what I was thinking. Thank you.
You're welcome. Thank you. Julie.
So I thought there was somewhere in here that I read, and I didn't actually note it because I didn't need to. But I thought there was something in here that did say that if we tried to collaborate with the family and the family is kind of like, I'm not really interested, that we still are obligated to do what we need to do to protect the safety and well-being of all children. Because that is part of this conversation, that while suspension and expulsion should not be happening, and we know there's a lot of research we don't have time for, but the flip of this conversation is the families who are also saying that their child who is being injured by another child has rights as well. And so there are times as a program where we have to say, this is what we have to do. Whether the family is going to want to be on board with us, we have to have some things in place for protecting the safety and well-being of our staff. I can't have staff being injured. We can't have other children being injured. And so, and in some cases, what that's led to is for families saying, then they're going to not keep their child in our program, which is their choice, because they don't want to comply with those things. We just did one where we basically said, we're looking at a different classroom placement within not only the child, but looking at which classroom they're in, so that we could look at different supports. And so I think sometimes as programs that we have to make some decisions. And I thought that was in here somewhere, that it says, even if the family's not necessarily willing to come to the table, that doesn't mean that we get to opt out of developing safety plans, that we still have to do what we have to do in our programs.
I don't know, Julie, if that is directly in here. But we can note that, because there is a documentation requirement for failed attempts to contact the family. Serious safety threat does include a safety threat to themselves or others, which is when you could use a temporary safety-based intervention. So maybe that's what you're thinking, but Julie, we have it noted and can see if, again, those 3 points are here. Kim.
Yeah, I just want to point out some of the questions that are being asked. It's clearly stated that if you're a certified childcare center, you must develop and implement the suspension and expulsion prevention policy. So once you implement your policy, then these other things fall under that once July 1 comes. So I think, yes, we have all these questions and we have all these concerns, but this particular committee is going through this because this rule is going to happen. This is what we're going to have to do, but it starts with all of our policies. So if a parent, you have to put in your policy, if your parent denies it, what does that look like? Or, you know what I'm saying? Like for us, and I can throw this out there, it might not be right, but we've given the parent a choice. They can come in and do the staffing that we would require to pay someone and miss their time off of work for one day to be with their child, which again, that's their choice if they want their child to stay in the program, if it's a safety concern. If it's normal behavior and challenging behavior, we all have to do what we do every day. Every day is a challenge. So just pointing that out. You can give parents choices too. It's not just the child, right?
Mhm.
Thanks.
You're welcome, Kim. Thank you. Yesy.
Again, I feel like in this serious safety threat situation, outdoor programs need to have a specific category that gets a little more specific as to what falls under that,
Okay. Okay.
Just restating that again, that like the definition of a serious safety threat needs to be different for outdoor programs versus an indoor program because there are so many different factors that we have to consider.
Yeah. Thank you. Okay. There's a time check. We are actually less than 15 minutes. And I don't know if others can stay past 5. And okay, so where are we going here? Okay. If a certified center initiates a temporary safety-based intervention, the center must contact ECB immediately to request services if they haven't done so already. So they're looking for those supports. Notify CCLD of a temporary safety-based intervention and its expected duration, so how long they are likely to implement this by 5 p.m. the next business date, so it connects back to those notification sections. And then the length of a temporary safety-based intervention may only be for the time necessary to incorporate supports to reduce the occurrence of the behavior. The temporary safety-based intervention must end as soon as safety can be maintained with supports in place. I'm going to quickly go through these. The certified center must document the basis for the duration. So they're documenting why or how long, the duration of it. And then during the temporary safety-based intervention, so that's that piece of what happens while the child is not at the program. The certified center must communicate with the family regarding updates on access to supports. So what's happening for them? How are they accessing supports and who are they contacting? And then any changes in the child's behavior while they're not in care. And then also a timeline to return. So they're providing communication with the family while the child is not in there. And then also finally, if requested by CCLD, the certified center must update CCLD if the expected duration of the temporary safety-based intervention changes. So if their original projection for how long it was going to, the duration of the intervention was going to be in place is longer or shorter, they need to contact us at CCLD. All right, Alicia. Let me add contact the family in 7C. Okay, 7.
I put it in the chat.
See here.
But just kind of recognizing across the board.
Okay.
When should a parent be contacted around when it's decided? I think it would be
there's a okay.
Yeah, if you're deciding to do a safety-based intervention.
That's a good call out. I think we have that in the notification section. There's all these different costs in licensing rules. So that's a good call out. Thank you.
Thank you.
Okay. Y is 11 only if requested and not required. If requested by CCLD. I will take that back. That is a good question. There are a lot of acronyms. Yes. Okay. Oh my goodness. Oh my goodness. Oh, I don't know why this is in here. It's a weird one. There's no updates in that one. Okay, so this is care of children for specific needs. I recognize that this section is very marked up. So I have actually rewritten it down here at the bottom. And so when a qualified professional develops a written care plan for a child that has a documented physical, developmental, behavioral, or emotional or medical condition requiring services beyond those typically needed by children of their same age, and the plan is provided to the center with parental consent, the center must implement the written care plan. So the big change here is that CCLD used to identify elements of a written care plan, and we have removed those because the written care plan is really supposed to be developed by a professional that is familiar with the child. And then it is the responsibility of the center themselves in conjunction with the family to implement a care plan for a child. So a certified center must implement the written care plan unless the plan requires the center to be out of compliance with rules. But a center may request for an exception to accommodate the needs of a specific child. And these are our exception rules. A really great example of this is a infant who may need a helmet while sleeping. We do not allow things in the crib, but we do allow for exception for an infant to wear a helmet while sleeping. And then the certified center must ensure that all facility staff that come in contact with the child are aware of and follow the written care plan. Okay, I see Alicia.
Yes, so I had a couple notes here. So just medical, like a medical condition would require a licensed medical practitioner for medical management of a condition. We're kind of like curious about qualified professional, that term, who is determined to be a qualified professional um, to address the different needs. Is it a particular professional for behavior versus a particular professional for medical needs? And I mean, especially to your point, just that example of the helmet, right? Like who decides that that is an appropriate, or that's going to be acceptable for that child? And then for number two, I'll just get it all out and then I'll put my hand down. For number two, many kids have multiple professionals and as a part of their care. So the development of plan should include the parent, hoping that that's a part of the person that's a part of the plan, and then whatever those qualified professionals are, and any independent practitioners. So we're just kind of curious about how is that input used? How is that plan developed when there's multiple people involved in the care? And so it's just not laid out as clearly. So.
Okay. Thank you. Julie?
Yes, I had the same thing about like, how are we going to define qualified professional and what does that look like? And then I started to wonder about the costs of, again, kind of like implementing the plan, et cetera, because like who's providing the materials, et cetera. In some cases that's medical, some cases it's ESD, some cases it's up to the parents, some cases it's up to the program. And number two, certified center may apply for an exception to accommodate. So there's nothing that talks about what that process is and what that could look like.
Oh, the exception.
That was my.
Okay. Sorry, Julie. The exception, like they would reach out to their licensing staff to go through the exception process. And then we have standardized forms and instructions. So that doesn't necessarily live in rule since it's a process. But yes, we do have those available for folks to do that. Yessie?
Yeah, I think this is another place where ONBs may need a specific rule set, because there are certain like written care plans that would be incredibly burdensome to carry out in the wilderness, if it's a forest school type program. So if it's a condition that, we find out after the child's already enrolled and then we receive a written care plan post enrollment and are then forced to, or required to carry out this very specific written care plan in an area where we may not necessarily have access to running water or whatever, things that could be required for it. I think that outdoor program may need some additional factors on that particular execution of written care plans piece.
Thank you, Yessie. So there's a couple of things in the chat. More information looks like around qualified professional. I will say that that was originally written as intentionally kind of open-ended to address any sorts of like behavior support plans that may come out of infant and toddler mental health consultation. So that because if we put medical professional in there, that excludes folks that may not be medical professionals but are developing behavior support plans. But we can definitely take that feedback back. And then I'm wondering about liability exposure when plans are vague or internally inconsistent. This rule assumes that the center personnel will be qualified to implement the plan. Writing exceptions places in additional burden on the center and licensing. Where does the line between reasonable accommodation and unlimited obligations live? And there are good questions to chat for Mercedes Point. Okay. I know we don't have a lot of time. I guess if people can stay on past 5, we can stay. I can definitely stay here past 5. But we are now into the definitions for the suspension expulsion prevention program.
Thank you, Abby. And so the good news is that many of these definitions are the same or similar to what we already reviewed in the licensing definitions. But what I want to preface this with is to say, now take off your licensing hat. We're not now talking about definitions in licensing rules. We are talking about definitions that simply describe the Every Child Belongs program and services. So the first place that we started here in the so we had developed an initial rule set in 2022 with some definitions. Some of them we are just modifying a little bit. This first one, early childhood care and education program, or I think we had provider originally. We are revising that slightly and saying or early learning and care program, which is a term that we use more often programmatically. And so we're just defining those two things together. And it includes this list of providers with B. Previously it said any program receiving state public funding for early childhood care and education services. So being revised or proposed revision to any program receiving state public funding for early learning and care services where such funds are for the purpose of funding a young child's enrollment in classrooms or childcare setting. So this is the recognition that sometimes there are public funds that a program receives that are not for early learning and care. And so we're specifically focusing on those situations. Any comments about this one before we move to the next one? Okay, I'm going to move quickly, but do raise your hand or add things to the chat as we go along. So this next one, number 3, Every Child Belongs, is Oregon's Early Childhood Suspension and Expulsion Prevention Program, as established by statute or ORS 329A.600. Every Child Belongs helps early learning and care programs keep young children in care by offering timely, responsive support when challenges arise. I'm going to read the next one along with this. Every Child Belongs Connect, or ECB Connect, means an online access point for early learning and care programs to submit a request for support in maintaining a young child's enrollment in the child care program. Julie.
Sorry, I really try not to talk so much. So I just kind of want to go back to which came up earlier about the timely and responsive support. So one of the things that's been very clear in here is there's a timeline for us to have to report, but then there isn't really much guidance on when we will receive that support back. And so it's kind of one of those, like, programs have an expectation of you have to do it by such and such a time frame, but then we don't have a time frame for when things are going to circle back to us.
Okay, thank you. I'm going to jump to the chat here for a moment. Mercedes says, thank you for including me in the conversation. Needs to jump. Early childhood mental health professionals are a rare commodity, especially in rural areas. Many of our areas, we do not have access. The counselors and psychologists are licensed in family practice and not early childhood education specific. The question about, is this being recorded? Yes. And it will be shared on the DELC YouTube channel. Someone is staying on Pass 5, but changing to phone. And somebody will follow up with the viewing it as the recording. Okay, so the next change being proposed is exclusionary practices. Means any, excuse me, any action taken by an early learning and care program that limits the enrollment, participation, or attendance of a young child due to the young child's ability, specialized needs, or behavior. Any thoughts on this one? All right, I'm going to move to the next one. Expulsion or expel means to permanently end a young child's enrollment in an early learning and care program due to the child's ability, specialized needs, or behavior. This is the same as what we already reviewed, and I was listening to all of the feedback that came in our earlier discussion. Jaya.
Just one thing that comes upon ability is centers are licensed to either have potty trained children or not potty trained. Like that's like that comes from the health I guess our health supervisors. So the health department. So for example, our school is not licensed to have children that are not potty trained, which could be under this ability. Maybe it's not for this, maybe it was for the past definition, but that came to my mind because potty training requirement, that's something where a center could get caught in the middle because one department is saying you have to have children that are potty trained. A child gets enrolled, we think they're potty trained, and then they can't really stay in the center because of their ability, or so just wanted to throw that out there.
Thank you, appreciate that. All right, the next definition is around infant and early childhood mental health consultation, or IEC-MHC for short. It's a prevention-based approach that pairs an infant and early childhood mental health consultant with adults who work with infants and young children in the different settings where they learn and grow, such as childcare, preschool, home visiting, and early intervention. It employs a culturally responsive and trauma-informed lens and involves providing consultation to childcare and early learning and care programs that promote healthy social emotional development and which builds on child, family, and provider strengths to ensure inclusive, supportive care for all young children. So this is essentially almost the same as what was originally adopted with a few wording changes. Kelly notes that Every Child Belongs staff do have the expectation of a 2-day turnaround time when receiving a referral and defining that as timely. So planned, oh, Julie, yes.
So, thank you for that, Kelly. So with the planned transition, where again, it talks about a program, professional consultant or support specialist. So is there the ability where, like, again, in our program, we have behavior support staff, we have people in-house or is it kind of the expectation that we have to bring in like that mental health consultant?
Yeah, I remember you raising this question earlier. The Are you part of a Head Start program? Am I understanding that correctly? Yeah. There
Yes,
is
I'm a Head Start program. I'm personally the education and disability specialist, and I've been in the field for about 40 years. So,
yeah. So we are, there is a work group that is working on what does this mean for not specifically planned transition, but what does the Every Child Belongs process look like for Head Start programs that do historically have a lot of services already. So outside of the scope of this particular conversation, but I hear your question. This definition of planned transition is noting that there are times when a child may not be able to be maintained in a classroom, and that when that happens, the transition should happen in a planned way. So the transition of a young child's enrollment from one early learning and care program to a different early learning and care program due to the young child's ability, specialized needs, or behavior. For a change of enrollment to be considered a planned transition, the plan must be developed in collaboration with the family, the staff of the early learning and care program, and a professional consultant or support specialist.
I have a clarifying question. So when it states that the plan must be developed collaboratively and then it goes on to the staff of the early learning and care program, is that the receiving program?
Ah, that's a great call out. Are you wondering about the well,
Right, because
yeah,
you could make
programs
traditionally
on
in
both
the ISFs, and you make plans for when they're going to be going into a child is going into kindergarten, and the receiving school is always invited. So in that case, I think that might be very beneficial for others to know the support you've held for that child. So there's no repeat of doing this whole process again.
Yeah. So you're suggesting the idea that both the current program and the receiving program would
Exactly.
be involved.
Because those folks are experts with the child.
Yeah.
Not
Thank you
well, and they're professional in their own right, so.
Yeah, thank you for naming that.
Mhm.
Yessie, it looks like maybe your hand raise function is not working, but I see you.
It was not working. But I have some concerns about the idea of this notifying the next school of what's been happening at one school, because a lot of things can be really like location and provider specific. And I have concerns about that particular idea, because what we wouldn't want to have happen is to have a big black file on a particular child that follows them like through their entire early ed experience. I don't think that would set children up for success. It may set the providers up to have more knowledge, but that's really the parents' role, not the centers, I think.
Okay, thank you for that comment. Kelly, I see your question in the chat. Who is the professional consultant or support specialist? Is it somebody from ECB or the Child Care Resource and Referral? And it could be. We have not defined. We've not placed further definition on who that is. And then suspension. This is the same definition as we looked at previously. Oh, No, it has an additional part, which is that the suspension may occur either in program or out of program. Meaning, in some cases, a child may be sent to the director's office or another space. If it's a center-based program, maybe sent to the director's office. That would be something we would consider an in-program suspension, where an out-of-program suspension is being picked up early or being asked to not come in for a day. And those are defined in the next items below. Melly.
So only because I have experience in this moment, what happened at our center was that the child would go to the director's office, and the director had so many fun things in that office that the child was going to make sure they were going to get there every single chance that they got. So that that is there might be something about the location. It might be more so directed towards a setting of a classroom, being that rather than the director's office or.
Yeah, when I mentioned the director's office, that was one example, but the definition of in-program suspension is really around that, removing the child from the environment, the learning
Right.
environment, to a different
Right.
space.
So maybe more clarification on that aspect.
Julie.
So as part of this definition, you have supported break is not an in-program suspension. And we have done that, planned breaks for kids. But I don't see it actually defined. And so that may be something that needs to be defined out for people so that they understand what a supported break is and how that looks different than, right? Because the supported break is done as a prevention strategy of, I know you need time out of the classroom so you can re-regulate and then we can step back in. It's very intentional, which is very different than you are out of control and now you have to go to. So, oh, I didn't see that. I'm sorry.
Yeah,
Great.
We didn't review it. We didn't
Thank you
review
for
it
pulling that out because I wanted to make sure like people understood that.
Yeah. Yeah, thank you for calling that out. We didn't review it because there's only just minor text edits, but yes, important to distinguish that from suspension. And finally, young child, the original definition that we had adopted back in 2022, we are proposing to change it so that it matches the definition used in the licensing rules. Reduce confusion. And I think that that is it. The rest of this section, you will see changes to from where it said early childhood care and education to early learning and care. And that's it.
It's like, where's my unmute? Yes, I believe you are correct that the other edits are just name changes. I have just one other slide to show, and I'm not even going to attempt to pull up my to present it in PowerPoint, but just the next steps. So there is one more RAC meeting next week. We have a couple of folks that will be present at both, and we really appreciate your time being at both these meetings. Next week's meetings will review the rules for family child care homes, as well as these rules again for the suspension expulsion prevention program. If you have other feedback, other things that you would like us to consider, there are other ways to do that. We are currently open for a public comment period until May 15th. So you've got a little over a month again to go back, mull things over, and then submit public comment. The ways to do that are on our rulemaking website. There's an email, an online form. You can also send things via postal mail. We're also hosting a public hearing on April 29th, where we just listened to testimony. So if you'd prefer to give verbal testimony rather than written, that is available to you. Again, the directions for that are on our website. Thank you, Al, for putting that in the chat. And then we will be proposing rules for adoption to the Early Learning Council on June 24th. Testimony is also accepted there. You'll need to reach out to our coordinator. Again, that information is on the website to learn how to provide testimony there with a proposed effective date of September. So we will use the summer months for license programs. We will use the summer months to prepare programs and our licensing staff to support programs for the implementation of the rules in September. And we will take your feedback that we've received today, go through it, and determine where we can make changes. The finalized rule text will be available in June within the Early Learning Council packet. And then finally, if you would like to get reimbursed for your participation in this meeting, you will be receiving instructions from Fabi, who sent the meeting invite. And I warn you, they're not fun instructions. And if you have questions, please reach out to Fabi, who can help guide you through that process. On behalf of myself, Delk, Katrina, and Cynthia, and Allison, we thank you so much for being here and staying 15 extra minutes. We really appreciate that. And if you have, again, any feedback, please reach out this way. You can also email us directly too if you have any additional questions. Thank you so much for what you do every day and spending time with us. And I hope you have a good evening.
Thank you, everyone.
Abby, quick question.
Oh, I'm gonna stop the recording.